Okay, so am I audible?
Yes, you are.
All right. So welcome you all to this second webinar on autism spectrum disorder. And this is here Dr. MYTHILI HAZARIKA. I am an associate professor of clinical psychology in the Department of Psychiatry, Guauhati Medical College and Hospital. I've been here from the last 2 decades, that is 20 years, and I deal with different kind of issues here in the domain of mental health. So I'm very delighted to have amongst us today Dr. VASAVVI ACHARJYA. She is the founder chairperson of Early Childhood Developmental Forum, and she's also the founder chairperson of INAAYAT, that is the D.N. ACHARJYA Foundation. Welcome you here, ma'am. And we have amongst us, the panelists are Dr. VASAVVI and SIMRITI SINGH. She is from Delhi, and she is the educator and founder of INAAYAT, that is an early intervention center for children's issues. And we have another person. She is from, again, ALIA El Nagar. She is a specialist in early childhood and the managing director of Swedish Specialized Center for Special Schools. So very delighted to have you all here as panelists.
Thank you.
Yeah, so we're going to start with this. I hope I can begin at this point of time, though I think the participants, all of them have not come yet, but still we can, start, right? So I would invite right now, ALIA. ALIA, I would like you to, throw light into the spectrum, autism spectrum disorder, what are the signs and symptoms, and the early detection, how to detect, and give us a view about the whole disorder spectrum of autism, please.
Sure.
Yeah.
Thank you very much, first of all, for having me here. I hope that we can all benefit, hopefully, today from today's webinar. So I will start, like you said, with explaining why we call it the autism spectrum rather than just autism. Because I always start to speak about a specific point, which is maybe the very most important point in my speech today, which is that autism is a disorder and not a disease. Because a lot of people confuse those things up to date, although we do have, a lot of recent research on all of that. But there's a lot of people who think this is a disease and therefore I should take medications and cure my son. But the thing is with the autism spectrum disorder is that it's a wide spectrum disorder, which is based on a developmental disorder that causes specific impairments in social interaction with the child, with communication, and with behaviors. So those are the three main things we say, to call it, okay, so those are the three main signs, let's call it, to say that this child has autism. I will go a bit further into detail because still there's some overlapping with other delays or disorders of children where they say, the child has speech delay, and they might say, oh, okay, then he might have autism, but this is not necessarily the case, because to have autism spectrum disorders, you must first of all go according to the DSM, and the DSM, the latest version now, is saying that there's a lot of changes because it's a very continuous research field that says if the child has two major things, which is social communication and the behavior, those are the two main things to diagnose autism. So what I would say, if we have a lot of families or parents in this session today, if your child is exhibiting any behaviors of speech, and I say disorder and not delay or communication delay, because it's not necessarily that there is a delay. A delay is very different from a disorder. So a child may be verbal, he might speak, he might, repeat words, but it's just not in the, let's say, the neurotypical way. So he might be, saying a lot of verbs, but just not in a functional way. So he might be saying words, but in random times, he might be repeating what we call echolalia. So he just repeats words, he just says words that are not functional. And of course, I say he or she, the child, it could be that the child has a very big vocabulary of words, but not just using it correctly. Okay, so that's the first thing I wanted to specify, because there's a lot of confusion between that and the speech delay. The second thing is I always say, look at the behaviors, and behaviors is something very clear that we usually can see clearly when we see a lot of repetitive behaviors with our children. So if we say children start hand flapping, they spin in circles, they take toys and spin them in circles. Usually children with autism have a fascination with spinning objects. Maybe even looking at the washing machine or like the fan when it's going in circles, things like that drag, drag their attention. So that's why children with autism, I'm just saying a few examples here that many parents can relate to, but just there's much more. And we call it a spectrum because it's so different with each child, so not necessarily each child with autism has all those symptoms. I'm just saying very different symptoms that could be apparent in different areas. Some children may have no behaviors or no repetitive behaviors, as we call it, but they may have a major issue in social interaction. And maybe that's the most apparent one, where we see children are not able to interact with peers in their age, or with siblings or cousins or relatives. They just don't know how to do it. So you can see they might want to do it, but they just don't know how to approach peers specifically. They might have an easier way to do it with adults because adults understand children, but it's more difficult with children in their own age. So those are the three main things we say. And again, I say spectrum because here we might have a child who have very, very slight, mild symptoms, and we have children who have very extreme and severe symptoms. So he might have all of what I just mentioned, and he might have only one or two. So that's why, because we say it's a spectrum, we say it's very individual. And because it's very individual, each intervention is also very individual. So it doesn't mean that, what works with Jacob will work with Sarah, because it's very, very different for each child. And that's another very important thing that I want maybe the parents to go away with today. Please don't compare your child to other children, because individuals, even adults with autism, are very, very different, very different abilities, very different talents, maybe even. So if we say something like Down syndrome, where the syndrome is, it's called a syndrome because most of the symptoms are usually the same, it's very different with autism. It's not the same at all. And that's why it's called an autism spectrum disorder, because it covers a lot of different signs and symptoms and behaviors. And that's the main thing with autism. So just in a nutshell, that's what autism is. Let me go just through some major, I'll just go through some. I'd like to also, I'm sure a lot of the parents who are attending with us today, they know what autism is, but like maybe some advice or like techniques of how to manage maybe behaviors, how to help their children. So because children with autism have, difficulties in communication in general, they also usually have difficulties in receptive communication and not only in speaking. So one of the things that usually help with our children is just to communicate in a way that's on the child's level. So speak very clear words, speak very short sentences, use visual aids, that usually helps a lot, visual support with the children. All these things, again, when I'm speaking in general, but again, what suits your child. And because we want to know, as parents, we want to know what works for my child, we need to do a lot of research. We need to understand, because the thing is with autism, what I've seen in my personal career and my personal life experience with in this field is that we usually go to the doctor immediately, pediatrician, oh, my child is delayed and this and that, so I will go immediately to the doctor or pediatrician. But the thing is that children with autism don't need medical intervention as much as they need behavioral intervention, or like communication intervention. They need help with those symptoms. So if I always say this as an example, just to make it clear to the parents, if I have an influenza, I'm not curing the virus itself, I'm curing the symptoms. I'm treating the symptoms, I'm treating the runny nose, the cough, and so on. It's the same with autism. I'm treating the speech delay, the speech disorder, I'm treating the behavior, I'm not curing the autism. So just, as in a nutshell, for the treatment or intervention, I'm not very pro medication, but usually medication might help in some areas, and maybe the other speakers can speak about this more maybe, but in general, medications would help with the more severe behaviors, more intensive, ages, the older ages. But in general, when we're talking about scientifically based, we're talking about behavioral intervention, occupational therapy, speech therapy, all that will help the child, but not necessarily medications. And that's one of the maybe takeaways for today, that we need to really know what to do with our children. So it's not always, nutrition, of course, has a big impact, what the child eats, if he has intolerance, allergies, all those things are very important to know, because nutrition is a major thing with a child. If he has a gluten intolerance or a lactose intolerance, they don't know, the family doesn't know this, it might impact them severely in the behaviors. So this is one thing we say, you know, unfortunately, autism is a very complex disorder that's not really understood till now. So we need to go in different areas to search. It's not only one thing, and this is how we do it. You know, it's very different from child to child.
Yeah, could you just tell us about the age when a child can be detected? How early it is?
Yeah.
Like, what is the age? Yeah.
So usually autism, it presents itself in the first 3 years of life. How do we know it? How do we detect it? Is by, so there's two ways. Usually I say the child is delayed from the beginning. So there is a, clear delay, clear disorder, clear kind of weird, strange behaviors happening. Or there's another way where the child develops very normally, just everything is smooth, everything is typical according to his or her age. And at the point of like 1.5 or 2.5 years, the child starts regressing. So the child starts, she used to say mama, baba, she used to say words, he used to say words, and he stops. She used to play with her siblings, he used to play with his, friends, neighbors, he stopped. So it just kind of goes like up in a curve where, the development takes the normal path and then it goes down. So it regresses. And that's where the family, that's more obvious. That's where the family says, okay, there's something wrong. My child used to do this and this and that, and now he's not doing it anymore. Whereas the other kind, where it's from the beginning, there is a clear delay or clear impact, it's not always that obvious. So usually we say in the first 3 years, but because now we are more aware of autism, we usually give it until 5 years to diagnose, to say, okay, maybe at age 4.5, 5, when he starts going to preschool, it becomes more obvious as well in the social setting, in a nursery, in a school. So we usually say from 1.5 and up to 5. That's the age where we can detect it.
And are there any instruments to detect autism during that time, during that 3 years time?
Yes. So what we use to detect or to diagnose is mainly observation assessments. So it's not like a medical test where I check, his blood test, so then I can see, or like an MRI scan on the brain. It doesn't work like that. We usually need to have 3 things. So we have the assessment with the child itself. So we do, one-on-one assessment. I don't want to go into details, but there's a lot of tools we use, like ADOS, for example, and maybe that's the most common standard one. But this is done by either a psychologist or a specialist or somebody in the field rather than a doctor again. And then we go do the assessment with the child. So we observe the child, we do the interview with the parents, and then we observe the child maybe even in natural settings like the school, the home. So there's different ways of gathering that data, and then we have a specific, scoring system for it. And if he is on that level of scoring, that's when we say, okay, he has autism spectrum. Again, could be mild, could be severe, could be moderate. But again, it's not kind of like a check where you go to the doctor and have a medical or a brain scan or something. It's more like observation wise.
Thank you so much, Alia, for a very comprehensive, nutshell about autism spectrum. So now I'm going to Simriti. Simriti is saying, so you can understand the kind of havoc the parents go through when a child is detected with autism. And there is a lot of denial and also loss issues, like parents just do not know what to do. So could you just throw some light into that area of parenting? What happens to those parents when they are in denial and, passing through losses because of this? Or when they hear first time that their child is autistic,
So yes, Dr. Hazarika, I'll also pick up threads from what Miss Alia just said. She spoke about autism spectrum disorder. And I will not deny the fact that it's extremely heartbreaking for parents to receive a report of diagnosis for their child. So they essentially go through a period of denial. So let's understand what is denial. Denial is essentially an emotion that arises from within us when the stress of a situation exceeds the ability for us to cope. When our ability to cope is limited and the stress is far more for us to cope, then we go into a state of denial. Any situation that requires extensive support and courage on our part is something that we don't want to do. So as the human mind will tell us, let's take the flight or the fight mode. So before taking the fight mode, we go into the flight mode, which is saying that this is not my reality. You are trying to trick yourself to say that you shun reality. It's a trick that you start playing with yourself. But it's also very important to understand that denial is a coping mechanism for the human mind. We all have gone into different phases of denials. at different points in our lives. So, well, it is an act of, it's a coping mechanism. It is also an act of self-preservation. You're trying to safeguard yourself against overwhelming emotions, and it takes time. We must also understand that denial is not bad. Denial is not wrong. It's very normal to have any phases of denial. But a very long extended denial can be bad because it affects the child's critical and crucial phases of development. So here I also want to tell you, why does denial happen to us? Why denial? Now, denial actually happens because the fear of the unknown is extremely terrifying. And autism is quite unknown, since there have been no reasons that we've found why does autism happen. And like Miss Alia just said, your child can be developing very well till 1.5 years or 2 years and then suddenly starts regressing. So autism is this ghost which is present between parents. It is present during your pregnancy. You keep wondering, will my child be normal? So the fear of the unknown is extremely terrifying. Secondly, there are also some conditioning that we've done to ourselves. We tell ourselves that, there's nothing wrong with my child. It's absolutely okay. My child is just having a bad day, or it's a bad month. We start going to all kinds of holy people. We go and ask them, is something wrong with my child? Can something be done? And of course, people will give you hope and they say everything's okay. So we start believing that. There's also a social conditioning that our extended family tells us that, autism doesn't run in our family. It can't happen to us. It doesn't happen to people like us. It doesn't happen to educated people. But autism can happen to everyone. It does not look at religion, caste, creed, or social status. That's why the denial becomes very important here. Then, once you receive your report of diagnosis, your family might just go down the path of grief. Because of course you realize that once you conceive a child, you also have hopes and dreams attached to the child. If you receive a diagnosis like this, you feel, oh no, all my dreams are shattered, all my hopes are shattered. So there are stages of denial, and I'll just walk you through the stages. The first most important stage is shock. The minute you receive a report which says that your child is autistic, there is a phase of shock where you're feeling numb and there is an inability to feel anything. The second stage is the stage of denial, where you start feeling that this can't happen to me. This is not meant for my family, or why me? The third stage is anger. You start feeling angry at the teachers, at the institutions, at the assessor, or sometimes just at the world. You start becoming very angry. The fourth stage is bargaining. You start to bargain. You start telling people that, okay, can we look at an alternate method? Can I just take my child to this holy person, and can I take my child here? I know there's a cure that exists. Then comes depression. Because after having gone through all of this, you start feeling very helpless. Then also comes relief. Because once you've gone through all these stages of grief, you start feeling relief for the fact that you've been able to identify the problem. And once you've identified your problem, you have to get to a stage of acceptance. Acceptance is the most difficult stage, for sure. Because once you come into acceptance, you want to go back to where you started from. And then one day you are still in acceptance and someone tells you, oh no, this is not, your child is going to be absolutely okay. And then you start your journey all over again. But once you've reached acceptance, you then also start taking action. And once you've taken action, like Ms. Alia said, early intervention is the key to handling autism. So that's extremely important for all of us to understand denial and the way it happens. The most important strategies for denial here are what I call strategies, which is awareness, acceptance, and hope. So if you are the person or you are the parent who has accepted that your child has been diagnosed with autism, it is extremely becoming of you to start spreading awareness. Once we start spreading awareness, you start educating people around you. And today what we are doing here in this webinar is also essentially spreading awareness. Once the awareness is spread, with that comes acceptance, not just in you, but also in your extended family. And your extended family becomes the most important support system that you have. Once there's awareness, it also is important that you, as a parent, as a teacher, start to show stories of hope. Because there is hope for autism. The child can be independent. It only is how we start working on early intervention. And when you start sharing stories of hope, automatically awareness and acceptance start coming in. So that's what I had to say about denial and these strategies.
Yeah, thank you very much, Simriti. But I just wanted to also want you to throw light into, you know, how this denial and acceptance and this loss issues, the stages of grief. People say that acceptance and hope and all. So hope is regarding what? Are you talking about hope regarding the cure of autism, or the hope that the child can do something in life? Can you just throw some light into that area?
Yes. So the hope essentially is that the child can be independent. You know, most of the parents who are dealing with a child with autism, the biggest fear and the biggest worry that they take with themselves to the grave is, what is going to happen to my child after I'm gone? So early intervention essentially means start early, helping your child become independent from a much early stage in life. And I will not deny the fact that a lot of children with autism are able to lead independent lives.
All right. So what about the intelligence? Can you just throw some light into the intellectual domain, like autism and intelligence? Like how are they related?
So, well, intelligence and autism. I'll also say, like Miss Alia said, autism is a wide spectrum. You can also have overlapping symptoms, like you may just have an Asperger's with an autism. You may have Down syndrome with autism, right? It's a huge spectrum. But the intelligence, I will not deny that just in a language is one area of language where they may just struggle. Otherwise, I've seen children doing very, very well in school settings or different settings where they're supposed to learn, or there are challenges that are thrown at them. And also it's very important for us to understand that they will go through a differentiated learning plan. They cannot all be put in the same classroom and expected to have the same learning objectives. Mm-hmm. Does that answer your question?
Yes, yes. So thank you very much, for this. And I would now like to go to VASAVVI, Dr. VASAVVI Acharya. So you are running a brand school, a preschool brand, right? And I think you are dealing with children of all kinds. So do you have, or do you come across children who has ADHD, autism, as they had said about the symptoms? Now you're quite aware that these are the symptoms. So do you deal with these children? If you deal with them, how do you go about it? Are there educators who are trained in dealing with them? Yeah, could you just throw some light into that? Yeah.
Yeah, sure. So in our preschools that we run, we have, at times children who come with some kind of either learning, slow learners, or a lot of children nowadays come with ADHD, because it's become quite, I think it's become quite common, the attention deficit, disorder basically. And we also see children with mild autism. Initially, it is very difficult to find out, because like Simriti had already pointed out, parents go through the denial. Okay, so when they come with the child, like we take children from 2 years onwards. So when they come with the child to school for the admission, either the parents, either they are not aware that the child may be a slow learner, or are developing symptoms, or have these symptoms of autism. So they just admit it. And once we are like, if the child is not able to cope probably, or the child is not understanding, we definitely, again get back to the parents to tell them about the difficulties the child is having regarding learning, or understanding concept, or understanding, the teachers. So that is how, what happens is, am I audible? Somebody's written it's not clear. Can you hear me? Yeah. Am I audible?
To us, yes.
Yes. So yeah, at times, so what happens is when we kind of understand that the child has some problems, I mean, learning disabilities, etc., we talk to the parents, take it very positively. The child, different, the treatments that are available. I mean, they are either given consultation and stuff. We have at times, we have consultants coming into our schools generally to deal with such. We find out the strengths and weaknesses of such children and try to, give that consultation to the parents as well regarding the child, or otherwise also help them meet up people who can give them the actual professional consultation, that is required at that point of time. We've seen many cases in our own centers where children are able to, overcome, like Simriti had said, and we are a preschool brand. So from our school, they usually go to a formal school, and there I think we have a feedback, they're doing pretty well. Probably, yes, they sometimes drop a class or a two, but then they are able to, cope, and probably they would be able to do well in their lives in whatever way, be it art, be it, any other avocation or field or profession. So we are looking at the overall. So we see that, yes, there's a lot of hope, there's a lot of acceptance in these days, and there's a lot of, inclusive education happening. So these children get a lot of scope to develop. They mix up with the other children and they tend to learn. So that is very important, I feel.
Okay.
Right.
So do you think the children with no autism or no ADHD, they get benefited by this inclusive education? What does your personal experience say?
See, children with no autism, no disorder, these children, actually, we feel that inclusive education is very important in terms of that responsibility, building responsibility in everybody. When we were in school, when we were younger, we never had children who had displayed some special characteristics with us, right? So we were always kind of separated, alienated from the whole concept. It was only those families who had children, their siblings used to care and all, so we were kind of separated. Now what happens is, when it comes to inclusive education, we see the other children also lending a hand of support, lending a, some kind of assistance, feeling more responsible towards the child. So that brings in a lot of, inclusivity, and that also gets empathy, and that builds up a complete society,
Yeah.
Community of, support system. Yeah.
So I hear a lot of stories like children from other children, I mean to say parents from other children, they create a lot of issues. Like when the inclusive education, the concept of inclusive education is something which is not understood by a lot of people, right? So sometimes I hear stories, because I'm in this practice for a long time, that the parents of the children who has no autism or no ADHD, they create a lot of issues to the educators when you take in these children with different kind of disabilities. So did you ever find such parents who were hard to deal with while including these children in your school?
See, I had faced these difficulties many a times, and I started my school way back in 2001 when I came back from Delhi after completing my studies there. I was pretty young, probably at that time, I was 24, 23 when I started my first school, and I used to be, a girl myself and running a preschool, which was a very small one at that point of time, And I had this incident where we admitted a child with autism spectrum disorder. I mean, she had signs of autism, and that was a point, when we had about 20 students, because I just started that year. And when this child came into the school, there was one parent who actually had a meeting with other parents, and they being older to me, because I was just 23 at that time, they came in together and said that we do not want this child in the school. Okay, and it was very difficult for me at that point of time, to actually convince them. And that was way back when I actually had to send that child away, because I was under that pressure. But that kind of thing would not happen as of today, because then it was a different scenario. I was younger, I did not have those answers. There was no, that nowadays there's a lot of inclusive education, it's a norm kind of thing. So I didn't have those answers, and I still feel bad about that, 2001 incident. And for that reason, we always try to include whenever they come for admissions. Even we have franchise. Basically, I run a franchise chain. So when my franchise calls me that, ma'am, we got a student with slight difficulty, this, that, they would say, ma'am, should we take or should we not take? I would always say, take them in and try to guide, and whatever additional assistance is required, give them. And either, connect them to people who can, after school, consultation and all of that. So I have been practicing this because of that incident, which still, kind of pinches me from time to time. Yes. This parent thing is always there. Always.
It is always, it's a hurdle for all of us to handle, basically.
Definitely.
It is across parents. It's not that only, people who are not educated. I think it is like a lot of parents who are very educated also thinks differently, in the case of a disabled child. Right. So now I would again go back to Simriti. Okay. So would you like to throw some, strategies, how to deal with, co-parenting issues, basically with children, co-parenting parents, handling a child with disabilities. Yeah. There's something very sensitive, and I think a lot of parents has this in their mind.
Absolutely. I was just listening to Dr. VASAVVI, and I can relate to her experiences because all of us as educators have gone through this kind of an experience. So talking about co-parenting, I'd also say that in co-parenting, we are meaning co-raising children together. So in a marriage, there are two individuals that come together and then decide to have offsprings. Now, when they have offsprings, we have no idea if the child is going to be autistic or not. Marriage itself is not easy, but co-parenting or co-raising a child with autism is again a different challenge. Here, we also must understand that each individual in the marriage comes with his or her own story, his or her own emotional baggage, and his or her own cultural baggage. So the way they respond to autism or the way they respond to the diagnosis is going to be very different. So we spoke about denial earlier. There can be times when one parent accepts it and the other parent is in denial. And those are very, very typical cases. So we get to see a lot of parents or families like this where one person has accepted and the other parent still doesn't accept it. And that creates a lot of strain on the marriage. So as a couple, it is very important for each one of us to understand that we are a team and we cannot function all by ourselves. It's also very, very important to understand that the bedrock of our marriage is love, respect, and mutual admiration, and not autism. So we see a lot of parents who receive reports of diagnosis. They start to just revolve the whole marriage around autism, which again just pulls the marriage in different directions. Marriage itself is extremely, extremely fragile in any way. So one of the most important strategies that I have for everybody here is the fact that it's very important to schedule time away from autism. The first 6-7 months of your acceptance are of course going to be autism. You're going to eat, drink, breathe, sleep autism. But like I said, it's not the bedrock of your marriage. You have to step away from that. Second, I believe Miss Alia spoke about visual timetables. The use of visual timetables for your children. In the same manner, when you have a visual timetable for your children, it's extremely important for you to be able to put down a little time, a little picture where you tell your child that mom and dad are going to go out for a walk. So with that, once it's in the visual calendar, visual schedule, your child will not have a meltdown because he's already prepared to what to expect. Half of the time, the parents do not have a life of their own, or they do not go out because they feel that there's going to be a meltdown. But once you put it in the visual calendar, the meltdown is reduced by many chances. Secondly, it's also very, very important to have a support system. Now, the support system can be the grandparents, can be uncle, aunties, or can just be your neighbors. So once you have a support system in place, There might be people who accept autism and the ones who will tell you all of this is bullshit. There have been people like that. But if you have a support system who now accepts you, it's a great idea to keep sending them weekly or daily updates about your child. Even something very simple as, now today my child buttoned his shirt. It's a very big achievement. So once you put it down as a text message, you can also tell your support group that I see now my child has been able to button his shirt. I think he's moving towards dressing himself. So all of us may not be on the same page, but once you have a support system, it's great to keep the equation going, great to have the communication going. The other strategy is that it's great to be able to have a visual timetable for yourselves as husband and wife as well. Because remember, you are a team and you start getting attuned to the visual timetable. In this manner, you can also start to get your child involved. So if the cleaning is happening by the dad and the mother is cooking, it goes up there. Our idea is not to overwhelm one partner with the daily operations of autism, because it is very, very overwhelming to live with a child who has autism or to raise a child who has autism. And the final strategy and the final tip that I have for parents who are dealing with autism is to have a financial budget. Autism can wreak havoc in a marriage, but also on our finances, because it's not easy. Therapies, appointments, travel, all of this requires a certain kind of a financial burden, a strain. So it's great to have a budget and put it aside, so that any time that there's another therapy or maybe an OT session that your child has to go for, it does not create fights and pulling your hair. So those are the final things that I have to say about co-parenting or co-raising a child with autism.
Yeah, so we understand that you had said that this is a team approach and everyone has to play their own part well, and there should be delegation of responsibilities. If they say no,
Sorry?
If they say no, our father says that, the autism has taken place because of not my contribution. It is for you, because you are the one who had given birth to a child, and it is not me. So because many a times the concept remains that it's because of the mother, autism has taken place. Then how do you deal with those issues?
So this is a very, very tricky question, Dr. Hazarika. We see a lot of parents, especially a lot of mothers, who say that the fathers are not on board with autism and they are in complete denial. Now the phases of denial are different. Like we discussed denial, but the phases it can either be a very deep phase of denial, which can extend to years, and a parent may never come out of it. But the fact is that you can give it a waiting period of 6 months, 7 months. Each one of us is going to react to a news differently. Mm-hmm. But if we have given it that waiting period that you have decided for your own self, after that, it's only time for action. Mm-hmm. And like I said, it is very important to look for a support group. It's all right if the parent is taking his time, that's fine. But the support group, and I will also request all the viewers that there's so much of support available online. Find a support group for yourself. Talk about what you're going through. Maybe we are not able to talk to our partners about everything that we are going through, but we have to talk. Otherwise, we get bottled up and then we have an emotional or a nervous breakdown. So find a support group, and it can be your own parents also.
It is a very important message that you had given right now, is that the stigma issue, parents have a lot of stigma to share their issues with others. They try to bottle down everything, and they take in a lot of stress. That is an assumed kind of stress. And this is a very good message that we should talk it out, share our problems. And there are hundreds of people who would come forward, if not your own people, I guess. Yeah. So that is a very, very important message. So would you like to, add on to this, ALIA? Would you like to add on to certain strategies to deal with these kind of parents or, co-parenting issues?
Sorry, I was on mute there. I would like to thank first Ms. Simriti, because she has a lot of good points in what she just said about the co-parenting. And I would also like to add about specifically, you said something about awareness in the beginning. And maybe this is one of the major things that I would put as strategies for, especially like you were saying earlier, the fathers, because it's usually that side that has the issues where the denial is strongest. And what we do there is usually educate the parents. So if the parents are saying, you know, no, he doesn't have anything, he just needs a few years to start talking, he just, you know, he'll be fine, this is normal, his sister was like that, you know, all those kind of things. What we do in those cases is sometimes a comparison. So let's say, okay, if you have another daughter, let's say, what did she do in that age? Was she exhibiting those behaviors? You know, was she specifically attached to routine? Was she not talking? Was she not playing with her siblings? And then I would ask the parent that question, and then the parent themselves need to answer. So if they say, no, she wasn't actually, that's where they kind of like start to realize that, okay, so maybe there is an issue. So it's not what I see a lot of mistakes happening with a lot of, you know, healthcare professionals when the parents are in denial, that they attack. No, this is how your child is. This is what it is. You know, you need to accept it. But it doesn't work. You know, you need to be on their side, like you were saying earlier, as a team. You know, it's a team. It's not only the parents or the grandparents. It's also even the healthcare professionals, the therapists. It's all a team. So just raising awareness and sending maybe videos, sending resources to the parents, how you know how this works. Like, these are all the symptoms of autism, and then if your child fits to all that, how can he not be on the spectrum? You know, so it's just kind of more like raising that educational, you know, level or aspect of the disorder. And then in that case, the parents themselves, they will take time, like you were saying, with going through the stages, and that's at some point they will accept it. But during those stages, it's very important to be supportive and giving the information, rather than just saying, okay, this is, I'm the professional, I have diagnosed and I know what I'm doing. You know, this doesn't work. So that's what I would say in terms of those strategies. Awareness is number one.
Yeah. So definitely, this is definitely going to help probably the people who are here today. And from your side, Vasavi, would you like to add something more to this, what she, as an educationist, you know, about co-parenting issues? Because you're going to deal with a lot of people, right? And the parents who, there are parents who are, I mean to say, in a joint family, there are single families nowadays, there are single mom, single dad, right? So I mean to say, what kind of problems do you think is you see in your daily days?
Yeah, so in co-parent, awareness is very important. And we see that there are at times both the parents get into this whole thing, you know, in a positive light, and many times for a very long time, which in turn affects the child. So we feel that awareness, number one, and a support system, even if not the family, a general support system to be generated is very important. Because I have seen one lady who had both the children were autistic. I mean, she had an elder daughter who was autistic, and then they planned another child, and very sadly indeed, the second child turned out to be the same. But it's usually the mother who caters to both the children, and the father is not much into it. So that is basically a very sad scene. And I feel that she has been getting a lot of support from the other areas, you know, other similar parents who are undergoing the same thing. So yes, she's able to. Now we are thinking that this support system plus awareness is very vital to deal with this. Yes.
Yeah, very true. So I think, you know, some understanding we have about autism, there are a few questions which I try to answer here, you know, in the chat. So people were not very clear probably about the intellectual functioning and autism. You know, intelligence is something to do with, you know, IQ. IQ is different from autism. Okay. So autism is basically a child with autism can have a very high IQ also. And it depends upon the scale, and it depends upon the domain that you're measuring. So many a times our intellectual scales that we measure intelligence has, speech, that verbal items are very strong, all right? And some kind of social items are also very strong. If an autistic child will definitely not score well in those items. So what happens, invariably the IQ score comes down. Okay, so many a times it happens that, an autistic child is also an MR, could be mild MR or a moderate MR. So it's a kind of a combination that happens with MR with autism and autism with MR. So there are certain scales that we only do autistic rating, like as people had said, CARS is one, ESA is one in Indian setting we use, where we try to find out the different areas which are affected. Okay, so if on the basis of that, we calculate the only autistic, not about intellectual status, because we feel that because of these areas which are deficit, maybe the global IQ has also come down. So we don't comment about the IQ when we do ESA scale or some other scale. So it's a very, a very blurred kind of a concept sometimes happens with people, that maybe autism is also a child who has MR. So I think people should be very clear about that. IQ is a global concept. Global means everything will be affected. Personal milestones like motor milestones, speech, academic performance, socialization, personal skills, communication, occupation, all the areas will be delayed. There's a delayed milestones that is called MR or IQ. But in autism, there are specific areas which are deficit, as ALIA had mentioned already, that is in the social areas, basically some kind of repetitive behavior. It could be motor, it could be speech, it could be something like that, where a person cannot connect. Auto means what? I. Autistic means I am involved with myself, preoccupied with myself. That is autism. But MR and IQ, a person who has MR or intellectual deficit, as we call it, intellectual developmental disorder, may not have autism. And that is the child can get along very well, connect to people very well. So I want you people to understand this basic difference, because there was one question here saying, 3 years, 7 months and all. So probably that child has autistic features more prominent rather than other developmental delay. So I think you should go for a assessment for autism. Okay, then you'll come to know whether it is specific autism or other areas like motor milestones are also delayed and other milestones are also delayed. I hope I'm clear about this. Okay, and yeah, there are issues that, as a medical, I've been working in this medical college for a long time, and I deal with the children's autism problem, and I give certificates like in Assam. I am in the autism board of Assam, so I have to see, diagnose and assess and give the certificate to get the disability certificate. And that certificate gives a lot of allowance for the people, for the parents to take help, like different kind of benefits are given to the parents with autism in communication, in education, in a lot of stuff. And also they are given some money per month. It depends upon the severity of autism, mild, moderate, severe, or profound autism. And after that, the social security is given, the social welfare department has to be contacted. So that is from Gauhati Medical College. For all of you to understand, then you have to come to Gauhati Medical College to get a certificate and get the intervention or whatever from me. Secondly, yes, there are certain published research work that has been published. You can go to search in my name, MYTHILI HAZARIKA, PubMed. In PubMed, we had done certain kind of studies, and it has been published. It is on different kind of attitudes towards disability, of parents' attitude towards disability. This is one study. It's a good study. People can go through that. And also there's a study of the impact of stress, coping, social support, and resilience of families having children with autism in Northeast India. That is also published in the PubMed. Another study that we had published is on the efficacy of psychosocial and vocational training in disabled children. So what I want you people to understand is, in the study that we had done on the parents' attitude towards disability, we had found a lot of love and affection towards these children. But at the same time, these parents had frustration and disappointment. Disappointment and frustration, as well as over-involvement. Why I'm trying to focus on that is that over-involvement doesn't help. Okay, because you have to make the children with disabilities independent. You have to make them run their lives alone. So you cannot make them dependent on yourselves, you know, on the parents. So you take the support, whatever is required, but not to make them dependent on the support system. That is very, very important. And in this study, we have found that over-involvement was there, as well as stigma issues were there. This study on impact of stress, coping, social support, and resilience of families having children with autism, it's a Northeastern, you know, based study. It was done on special schools. So in this study, what we have found is, yes, coping is good. You know, there's a lot of support for these parents, but they also get a little bit difficulty in their personal time. That is a personal time constraints for their professional advancement. You know, professional growth is not happening in these parents, and they are finding no time for that development. You know, that is quite a sad thing to happen, that the parents are not getting time to develop their own professional pursuit. And many a times, religious and spiritual coping mechanisms are taken by these parents. That is another thing that we found in this study. There's another study that we had done and published also, that is about the vocational skills training. Does it help these children? Yes, it helps. We had seen that, you know, assessment, pre-assessment and post-assessment is done before the training and after the training. And we found that mild, you know, MR, you know, a child with minimum degree of mental retardation as well as minimum degree of autism has high recovery rate in overall functioning in their day-to-day life. So I mean to say, so research is going on still. I think statistics, it will be very, very difficult for me to talk about statistics. I think people can, you know, give their own opinion about statistics, because we know that 1 to 2% are intellectual developmental disabled cases in India and across the world, and it varies. Now it is happening in 4 to 5%, and in some studies it is going even to 15%. I mean to say, it's a variation of studies. So I think more studies will be required to understand the statistics about you know, recovery of symptoms in an autistic child. That is one area people can go forward with that and do some more studies in the prevalence rate, and because it's something very individualized. You know, as she had already said, that, you know, things are very, some features are so specific, and no two children with autism will have the same features. So it is so individualized, and individualized kind of training approach is to be taken, and also with group therapy approach is also required for these parents. Yes, another thing is very important to understand is to do some kind of therapy with the parents. You know, what I do, because I'm called here and there to give speeches and, you know, these kind of lectures and seminars and conferences, many times I ask both the parents to come. You know, I would suggest that, you know, both of you need to come and hear what I say, because it should not be only one parent taking up the entire stress on herself. So it should be delegated, as people said. So in the first psychoeducation setup, I do not do counseling only with one person. I make it a point that, yes, I will see you, but provided both of you come. Because from the very first day, you have to inculcate that kind of a knowledge to both the parents, that you both are important for the child, not only one person is important for this child. So that kind of accountability is required to be, you know, made and established on the very first day of the meeting, when you break the news that your child has autistic syndrome. So I mean to say, this is how we, the therapists, needs to go forward, because the stress in one parent is immense, and she or he breaks down. Not only with a mother, I found fathers taking up a stress. I have met one father, I still am so very clear about him. He had given up everything. I mean to say, he's rearing up this kid all alone from day one, because the mother could not take it. The mother could not cope up, and mother says, no, I just cannot go on with this child because I don't know how to deal with my child. And she just left. And this particular father is rearing up this child. Now she's a teenager all by himself. He's just kind of given up many things in his life, and he doesn't feel sad about it or disappointed about giving up things for the child. So that is very important. It is not only a mother, it could be anybody. You know, both the sexes needs to play their own part in rearing up a child. I mean, it's a child with no behavior problems are also difficult to raise up nowadays. So we can understand a child with some kind of special problems, how difficult it is. So I think these kind of webinars will definitely show light to and throw light how to go about it and all. And thank you to all of you And I definitely would like some questions to be taken. And I think in the chat, there are certain questions and I would like to answer people about that. Right, so so there is this question, I think, spiritual coping and something like that. She just said about that. I don't think so there are any questions here, all thank you notes. So if there is anything to ask, you're not very clear about certain things and, and do we all get the certificates too? I am MYTHILI HAZARIKA. I am not Kalpana HAZARIKA, but yes, we can get certificates. You can get certificates from the medical college, Guwahati Medical College, where I give the certificate as one of the members, and there are 3 members and 3 of us has to sign it after I do the analysis and the diagnostic part. And another thing, right, the discussion will help me a lot to understand and observe the behavior. These are all thank you note. I think people are very, very clear. And speech delay issues, ma'am. Can you just explain about the speech delay issue again, Alia? I think people are not very clear about the speech delay and the relationship with autism.
Okay, so as I was saying earlier, there is overlapping symptoms or signs between people with speech delays and people with autism. Now, children with autism can and will probably display speech delay, but it's not necessarily the other way around. So if I have a child with speech delay, doesn't mean he has autism. Okay, and as I was saying earlier, he might not have a speech delay, but he might have repetitive speech. He might not be able to use the speech functionally. So that's why, as you were saying earlier, it's really important to do an assessment to know exactly what does he have. Is it only a speech delay or is it autism? And as you were saying also about the IQ and the intellectual abilities, it's really specific to that area. So does your child only have speech delay, purely and only speech delay? So speech delay here means that instead of saying like a 2-word sentence at the age of 2, he's saying a 1-word sentence. So that's a speech delay, but it's still in the right area. It's still in the right, frame of communication. So if I ask a child, what do you want to eat? And he says cookies, then, maybe he's 3 years old and he can say that. That means he has a speech delay. But if I say, what do you want to eat? And he says, TV, or like something that has no relation to what I'm asking him, then that means there's a speech disorder or a communication disorder. And that's the difference between those two. So it's really important to understand that a speech delay doesn't necessarily mean he has autism, but it might mean if he has autism, he will have a speech delay. So it's really important that we do the right type of assessment to understand what is the diagnosis of the speech delay or speech area in general.
All right, so I hope people are clear about that to a certain extent. It's an expressive speech delay and receptive speech delay. There are 2 different areas about speech, okay? There are the Broca's area and the Wernicke's, areas that are affected. Let's do something with the structure of the brain. So if there is a speech delay, then you have to go for speech therapy. It is only one specific area that is called specific delays. Specific delays in speech. So I think expressive speech delay is one thing, that is one area that could be addressed with speech therapist. Yes, in that way, we have intervention in different ways. If a person has, say, motor disability, then we say physiotherapist. So in that way, we do give the intervention in different areas in life according to the disabilities. So here, people are asking a lot of questions about cure and causes of autism and other stuff. So again, I would like to reiterate the fact that it is not a disease, as Alia had started with, the concept of disease and disorder. So people, you need to understand that cure happens only when it is a disease, okay? Cure doesn't happen when it is a disorder or a disability. There's something with a deficit or slow in certain things that is not, it's a condition. Okay, so it is a condition that with therapy, with some kind of intervention, it can progress, it may not progress. So it depends. So we do not use cure in autism, all right? So I hope that is clear by now. Causes of autism, it is a neurodevelopmental disability, okay? It is something to do with the brain. So it is something to do with the genetic factors, environmental factors, and a lot of structural factors in the brain that is involved in autism. So you have to go back and see, because it is known as a neurodevelopmental disability because of that. So there are, why then, if it is a genetic issue, then why two children of the same parents do not have autism, only one child has and one doesn't have. So, so many factors are contributing to the evolution of autism. Their research is lacking for me to state something which is, the fact and the cause of autism. So it is an intermixture of many stuff and a biopsychosocial interaction, but definitely the brain has a lot to do with autism. So many times when she said about medicines curing it, no, medicines doesn't. Somebody had said about medicines and Alia had said about medicines. Yes, medicines does help in certain features of autism. Like a child with autism, if he's very much with himself, as I said, autistic means to be with himself, preoccupied, to come out of that kind of a preoccupation to oneself may be helped with medication to a certain extent. So people start with antipsychotics so that they are in connection with the real world, so that the child can come out of his world and connect to the society, for which medicine helps. Sometimes a child with autism may have aggression, then the medicine may help. A child with autism may have depression, then medicine may help. A child with autism may have anxiety, then medicine may help. But autism per se, the symptoms of autism will not get cured totally with medicines. So we need to understand that the early intervention and early detection is the need of the hour. We have to detect the person with autism very early in life and start with intervention. That is the second thing I wanted to say. There was another thing that was, asked by somebody, that if person is not, if a parent is not ready to accept and not ready to do the test, there are different methods to motivate a child's parents. Many times what she had said about denial, that is the Elizabeth Kubler-Ross's model of denial, that she talked about, denial, anger, bargaining, depression, acceptance, resolution, and all those issues. You know what? We always go through all these stages in life in different ways. So what is important to understand that this parent might be going through an elongated denial phase. So in order to make the parents understand, then you have to do your part very well. You have to make the parent understand that this is not for you that the child is having an issue. The child independently is having an issue. Sometimes parents feel very responsible for their child's behavior and they become overly responsible. They think because of them this has happened, and they just cannot stand it. And because of that, they do not take the treatment because they cannot deal with their own issues. So what is important to understand is to make the parents feel very normal, normalize the whole setup, make them feel a lot of children will have different kind of problems. Even normal children are having problems that we as psychologists, we cannot handle, because a child who has no problem is so much problematic, in today's world. So you need to give such kind of example that in today's world, children with behavior problem, children with autism, children with no behavior problems are all same. Everyone creates problems in life. We, the parents, create problem to our children creates problems to us. It is some kind of an interrelational hypothesis. So you need to make the thing very normal and minimize it and normalize it, to not maximize it and magnify. If you don't make the parents feel overwhelmed and magnify, then they are going to accept what you're saying and they're going to go for the treatment as well as the intervention, that you suggest them. So another thing that somebody had said, it's something to do with the sensitizing the teachers. I think this is the platform that we are doing. We are sensitizing the teachers, we are sensitizing the parents, we are trying to sensitize the educators, how to educate the parents and their teachers and how to go about it. Right, so yes, there should be more seminars, more talks, more such kind of discussions in various platforms so that teachers know who they are dealing with. And I think this kind of child psychology should be a mandatory chapter for all teachers to learn when they enter into a school. So probably you all can give pamphlets, you can give educative materials for the teachers, whoever has come for teaching, you can give all those knowledge. That is another way of dealing with things. Sometimes they get very angry and blame the teachers or the people recommend them to do so. Yes, that is again comes under denial and angry, as she has already mentioned. But this is a phase, and this is something which is very normal. People cannot accept sometimes certain things which are so negative in life. Why me, and why did it happen to me? And they get very angry because they feel they're responsible for this. So if you can make them understand that they are not responsible for this, then the anger will come down. There's another thing about the nutrition people have talked about. Yes, diet and nutrition, a lot of research is going on this, but again, it plays a part. But why, what, antioxidant helps, and a lot of other stuff, a lot of research is going on. Probably this is one area I would like to study more in this diet and nutrition, and all of us have to develop our knowledge in diet and nutrition. And I'm at this point of time, I can really not answer this question about diet and nutrition. If somebody else can answer, I'll be very happy. Simriti, if you can answer about diet and nutrition, because I know about omega-3 fatty acids and antioxidants and all, but does it really have any impact on autistic children? Can you just throw some light into this?
I'll just start from the very basic about textures while eating food. You see a lot of autistic children who have issues with chewing, or if they chew something, they have different textures. They might just like very chewy food. For example, I've known a few children who would just keep chewing on chicken because it gives them a sensory processing pleasure from their mouth. So they start from that. That is one aspect that we have to understand about the textures and the sensory issues that the child receives from there. Second is GI, gastrointestinal disorder and a bowel disorder. These are interrelated and are usually one of the most important symptoms of diagnosing autism. You will see children will have varied kinds of issues, and Alia spoke about gluten. I'm sorry, I haven't gotten the right word, but inability to handle gluten, right? So these are a few symptoms that a child exhibits in the first 2-3 years of his life. But like Dr. Hazarika said, that there's still a lot of research that is going into understanding GI, bowel disorders, and omega-3 fatty acids. So while we do not have the research with us right now, that's all that I can say right now.
Yeah, so there are certain questions and answers. I think this will go on and on and on if I have to, because a lot of gray areas, a lot of gray areas. So we cannot give a direct answer to a lot of things because this is something, an evolutionary concept. As you can see, in DSM-5, the language part is deleted, and this communication part, speech is deleted, and it was very much there before DSM-5 came in. So again, ICD-11 is going to come. I don't know what is going to happen after that, after ICD-11 and after DSM-5. So I think this is something which is, we are all working on this, and we are thinking it as a broad concept right now. We are saying it's a spectrum because autism, Asperger's, childhood disintegrative disorders, atypical autism, everything is now Rett's disorder, everything is under this spectrum, right? So I mean to say we have to know about all these slowly, but what we have to understand at this point of time, if you see anything which requires help in a child, may it be in walking, in eating, in talking, in sleeping, in writing, in reading, in spelling, in punctuations, anything where you find that something is not okay. Something is not okay at this age. At 1 year, I think something is wrong, and I compare my child with that child, and my child with my elder child. Something is wrong. If that instinct speaks, go by the instinct. Just go by the instinct. If something is wrong, just go and show to the doctor. I think that helps because parental instincts speaks a lot rather than any others instincts or assessment tools. And parents are the best educators. Parents are the best persons to diagnose autism or intellectual deficit. And I would all suggest that parental education, parents needs to be educated by the pediatricians, parents needs to be educated by the gynecologist, parents needs to be educated from the very beginning of the plan to have a child, that is during the time of pregnancy, right? Simriti, do you agree with me?
I absolutely agree. And Dr. Hazarika, I wanted to say at INAAYAT, we are running parent awareness programs. Especially with any parent who needs hand-holding, conversations, we are providing services for that.
Yes, so that is what I think, is required and is a need of the hour. And yes, I think we should wind up now, right? And anything to add by anyone? VASAVVI? Yeah.
I would want to make a small announcement before we wind up. That's about a global online conclave that we are coming up with. Darpan, you can show the screen. Yeah, we are coming up with a global online conclave. The theme is the essence of future readiness, empowering early childhood learning post-COVID-19. So there'll be a range of speakers, about 20 plus speakers from all over the globe, speaking on various concerns regarding children, empowering parents, supporting schools, etc. So I invite everybody to be a part of this conclave, and we'll share more information later. Today I did a final, an announcement, formal announcement today being Eid. I wish everybody a very, very happy Eid. And I also thank you immensely, Dr. MYTHILI, for taking this up as a moderator, and ALIA and SIMRITI for being here. It's wonderful, and I can see a lot of positive comments, positive things from the parents. So it's a lovely one. Thank you so much. Take over. MYTHILI.
Yeah, I just want to say I could not answer these questions that are there. I think nobody could answer them. And I think you can give them our email IDs and email addresses.
I think you can share. You can share with them. You can type it. Yes, you can type it in your chat. Yes.
Yeah,
you all can type it in the chat. Yeah, they can get back to you.
Yeah,
with all these. Yeah,
not very easy to answer everything.
Yeah,
right
even
now.
SIMRITI and ALIA can give your mails. Yeah.
I would have been very happy to take it, provided I had the time. Thank you very much, everyone. This is my number.
Thank you.
And this is my email ID. Thank you, ALIA and SIMRITI. And that was wonderful to have you and know you like this. And VASAVVI, always a pleasure to have you. Thank you very much.
Yeah. Thank you so much. Bye-bye.
Bye-bye.
Bye.
Thank you.